All right, everybody, we are back from the break. That was a quick break. So let's keep up the story where we were. We were talking about blood flow through the heart, and we had gotten to the part of the aorta. I said there are three parts of the aorta. You have the ascending limb, the aortic arch, and then the descending limb. And so that's where we are. We're going to pick up the story from there. So coming off of the aorta, so let's get my highlighter back. So coming off of the aorta here, we have these three branches. So what I'm going to do is I'm just going to move this portion about the lungs, move that out of the way. And let's talk about these three branches off of the aorta. Okay. So the very first branch that we get to, as soon as blood comes into this aortic arch, this very first branch, let's go ahead and label that. That's going to be the brachiocephalic trunk. And don't worry about writing this down. That's going to come up again in just a moment, but I'm just going to write it in for you for now. This is the brachiocephalic trunk. Okay. After then, blood leaves and goes into the next division here is the left common carotid artery. Okay. So we have the left common carotid artery. And then from here, this next branch is the left subclavian artery. Okay. So all I've said is we have the brachiocephalic trunk. Let's break that down. Brachio, so that's pertaining to the arms. Cephalad, pertaining to the head. So pertaining to, for instance, the right arm and the head, the right portion of the head, that's the brachiocephalic trunk. Now, where we have this left common carotid artery, let's give me a little space here so I can draw this out for you. So what happens is, so if this is the left common carotid artery, okay, now it's called the left common carotid artery because it's going to bifurcate or divide into two areas. So for instance, okay, oh, and by the way, what is this little spot here, this little bifurcation spot from it with or within the left common carotid artery? What's the bifurcation where it goes into these other two divisions? Anybody know what that's called? So that's actually the coronary sinus. In fact, that's near this site, near this spot. This is a site of some of the baroreceptors that's involved in maintaining blood pressure, for instance. So we have the left common carotid artery. So this is the common one. It bifurcates into, for instance, on the left side, this one is the one, this portion here. This will be the internal carotid, the left internal carotid artery, and then we have the left external carotid. Same happens on the right side. Anyway, all we were saying is we have the brachiocephalic trunk, we have the left common carotid artery, and this left common carotid breaks into the left internal carotid and the left external carotid. And then we also have the left subclavian artery, okay? All I really want you to know is just know these three main branches. Okay, and then let's continue the story from there. So after blood leaves, okay, so actually here, let's just go ahead and write it in here. So I'm on page 5 of your workbook. We've covered a lot, even though we haven't gone many pages, we've covered a lot of information on these pages. So this first branch, so as blood leaves the left ventricle, remember it goes through a valve. What's the name of that valve? That's the aortic valve or aortic semilunar valve. Then it gets into the ascending limb of the aorta. The first branch off the aorta or off the aortic arch is the brachiocephalic trunk. Okay, the next branch off of the aortic arch is the left common carotid artery, left common carotid artery. And then the final branch off the aortic arch is the left subclavian artery. Okay, just make sure you know those three. Now from there, the blood has now gone throughout the aorta and then gone to the head, both sides of the head, and then it's gone to the left and right arms. From there, the blood is going to come down the descending limb of the aorta, and now it starts branching off into all these different vessels. And so let's talk about the different vessels. So the very first branch after the aorta, which is the largest artery, then it's going to get into the medium-sized arteries. So it's going to get into smaller arteries. Okay. From there, the blood actually goes into the smaller or the smallest of the arteries, and those are the arterioles. Now, what do we know about the arterioles? The arterioles are what are known as the resistance vessels. So when we say resistance, those are the ones that are involved in regulating blood pressure. So those are the ones that have smooth muscle around them that, for instance, when those smooth muscles, let's just draw that for you. So we have, we have a blood vessel here, and then surrounding the blood vessel is smooth muscle. Okay. And when that smooth muscle contracts, for instance, it causes, when the smooth muscle contracts, it actually causes this blood vessel to narrow. We would call that vasoconstriction. Or when the smooth muscle relaxes, the vessel dilates, and we call that vasodilation. Okay. Oh, let's just talk about it for a moment. Since we're on the subject of vasodilation, what is so let's take a drug like a nitrate. Let's say nitroglycerin or any of the nitrates, whether we're talking nitroprusside, whether we're talking a nitro drip, any of the nitrates, any of those things. And by the way, what's the mechanism of action for nitrates? Somebody tell me. Okay, so what second messenger does it work on? Okay, it's going to, unlike most things that work on cyclic AMP, nitrates work on cyclic GMP. Make sure you know the difference. Nitrates work on cyclic GMP. Now, what do nitrates do? So nitrates, for instance, yes, we say they are vasodilators, but when we say vasodilator, we're really talking about arterioles. So remember how blood came from the aorta, and then it went from the aorta to medium-sized arteries to the smallest arteries called arterioles? Nitro works on arterioles, it does, but it primarily works on the venous side. It primarily works on veins. So we would say primarily nitro is a venodilator, even though a lot of books will call it a vasodilator. Okay, so that's just some extra. So let's get back to it. So we have the arterioles there again, which are the resistance vessels that constrict and dilate to maintain blood pressure. Because there again, it's all about maintaining that cardiac output. The next set of vessels we get to, all right, so let's change my color to purple there. The next set of vessels we get to are the capillaries. What's special about the capillaries? All right, so what do we know about capillaries? We know that the capillary or the capillary bed or the capillary network, that's the site of gas exchange. Now, what gases are we talking about? For instance, we're talking about, this is where we have the exchange of oxygen that comes in, but carbon dioxide needs to go out. So this is where those gases kind of switch places. Oxygen then goes and gets released to the tissues through the Haldane and Bohr effect. And for instance, in the Level Up Medicl Mastermind group, I will go over that in great detail when I get into the respiratory physiology. But capillaries are the site of gas exchange. And then let's go back to the screen. So from there, blood goes into the venous circulation. So it goes first into the smallest veins called venules. What's that called? Venules. Then it gets into larger veins, and then it finally gets into the largest vein, the superior vena cava and the inferior vena cava. Okay, so let's just go back over that. That was a lot, but let's go back over that. So we said that blood came here. Let's just go over the whole story again. You ready? All right. I want you to see how much you're able to get with me. So as I say this, or before I get to the answer, I want you to see if you can beat me to the answer. Are you ready? We're going to talk about blood flow. Blood starts off, and remember, the blood first has to get into this right atrium. It's going to come through how many parts? I said there are three. It's going to come through the superior vena cava from the head. It's going to come up from the feet through the inferior vena cava. Within the heart itself, it's going to drain from the heart into the right atrium through the coronary sinus. So we've got superior vena cava, inferior vena cava, coronary sinus. Those are three places. Blood is now in the right atrium. From there, the atrium fills up. Now remember, I'm just doing one side at a time, but it's really happening. What's happening on the right side is also happening on the left side about the same time. Blood leaves the right atrium and goes through the what valve? Tricuspid. Blood goes through the tricuspid valve into the, that's right, it's going to be the right ventricle. from the right ventricle, it's going to go through another valve. What's that valve? That's the pulmonic valve. From there, it's going to go through the pulmonary trunk. It's going to go through the left pulmonary artery, the right pulmonary artery, and it's going to go to the lungs. So, of course, this is the left lung, and then this would be the right lung. That's what I'm drawing there. Either way, after we're just going to say lungs. After blood leaves the lungs, it's going to return through the pulmonary veins. There are 4 of them. You have 2 on the right side and 2 on the left side. All 4 pulmonary veins feed into the left atrium. From there, blood leaves the left atrium and goes through the what valve? That's right. It's going to be bicuspid or mitral valve. From there, it's going to go into the left ventricle. From the left ventricle, blood is going to go into the aortic valve. Through the aortic valve, blood goes into the aorta. We have the ascending limb of the aorta, we have the aortic arch, and then we have the descending limb. Off the aortic arch, we have the brachiocephalic trunk. Then we have the, what is this one? What's the next one? It's going to be the left common carotid artery. And what's the third one? It's going to be the left subclavian artery. You got that? We said that, for instance, the left common carotid, it bifurcates at the coronary sinus, and it's going to bifurcate, for instance, into the left internal and left external carotid arteries. Okay? After blood goes gets into the descending limb of the aorta, for instance, it's going to go to all these different arteries throughout the body. We have arterioles, those are the resistance vessels. Then we have capillaries where gas exchange takes place. Then it gets into the venous circulation and goes through the smallest veins through venules. Then it gets into larger veins. And then by the way, the veins, so if we said that the arterioles are the resistance vessels, the veins are what are called capacitance vessels. So those are the ones that really stretch out the most to be able to hold the most blood. So for instance, let's say, how would we apply this information? Well, if we know that veins really stretch out, for instance, and can hold a lot of blood, all right, let's say a clinical application of that. Remember, I was just talking about nitrates. So let's say somebody's having an MI, for instance. Let's say they're having an inferior MI, and for instance, the right coronary artery is supplying the blood there. Well, what happens in that case is when you give nitro, it really dilates the veins primarily, more so than the arterioles. So it really stretches out the veins. Now you can hold a lot of blood down in the veins, for instance, down in the feet. So let's show you what would happen in the setting of an MI. And we haven't even gotten to MIs, but I'm just showing you how to apply something about veins, for instance, and the physiology of the circulation or the blood vessels. So let's say down here in the feet. Well, when we stretch out these veins, now we keep a lot of blood down here in the feet or down in the lower extremity. Well, what that means, so if you just gave this patient who's having an inferior or right-sided MI, for most people, the right coronary artery controls blood to the bottom of the left ventricle. So if this patient is having an MI, you give them nitro, you keep all this blood down in their feet. Well, if they're having a heart attack that's affecting the right side of the heart, let's say they're having a right-sided MI, what happens now is blood is down here in the lower extremities. The right ventricle is already not pumping effectively. So in essence, what happens is blood is not pumping out of blood is not pumping effectively out of the right ventricle, and you're not allowing blood to come back into this right atrium. So blood doesn't come into the right atrium, and blood doesn't go out of the right atrium or right ventricle. So you've affected them in multiple ways. There's a likelihood that you could cause death. So I'm not saying that you would never give nitrates in the setting of, for instance, a right coronary infarct, but I'm saying you need to be very careful. So maybe instead of hitting them with that 0.4 milligram sublingual nitro tablet that you place under the tongue, maybe it's safer to give them a nitro drip, for instance. But there again, follow your protocols. This is not per se medical advice. I'm just giving you education on the science. Okay, so let's keep going. So we just went through all of the blood flow. But so I said that the veins were the capacitance vessels, and then we get into the largest of the veins, and that's the superior and inferior vena cava. Any questions on that? Now, okay, if you have questions there, again, you can always text me, you can message me in the chat, you can send an email, and I will get back to all the clinical, medical type questions. And if it's general questions, then somebody else from the team will answer those questions. All right. So